Good afternoon, Professor Leese and all my wonderful classmates in this Healthcare for Informatics class. I am going to be presenting this afternoon a presentation about informatics in healthcare and telehealth. The objectives that I'm going to discuss today are telehealth and relationships to my future practice. There'll be a discussion about why telehealth is important in healthcare informatics, a description about the research and how it relates to telehealth in my future role, ethical and legal issues about telehealth. I'm going to justify why there's no need for change for the current module that I planned on employing, discussion about trainings needed for the evaluation and their success, and lastly, a discussion about the changes in public policy and advances in technology in regards to telehealth. Telehealth in my future practice. At this time in my career, I'm seeking employment with outpatient addiction services. Outpatient services are already well established at my current employer. My employer has a behavioral health department that provides inpatient and outpatient services. The 2020 COVID-19 pandemic has created additional opportunities in nursing to meet the needs of this high-risk population remotely. Telehealth for mental health problems and substance use disorders has taken a more central role as a direct result of this pandemic. This type of services does require collaborative care from nursing staff. It also includes primary care, pharmacy enrollment, mental health services, specialty care, virtual groups, and one-to-one sessions to address coping mechanisms, relapse triggers, and amelioration goals. Our outpatient services has expanded and is utilizing telehealth, and I'm really interested in an internal transfer. It seems very interesting to be able to provide services for a population that's dealing with so much. The nurse works closely with the providers, social workers, and KSAC counselors, which are certified alcohol substance abuse counselors. This slide captured me because you can see it says addiction, bold, and it can be anything. It can be drugs, it can be alcohol, it can be methamphetamines, different stimulants. So this was very intriguing. The behavioral health subspecialty is providing dynamic services to this often misunderstood fields of healthcare. The opioid pandemic, along with the COVID-19 pandemic, has identified a need for virtual services since many recovery models are based on self-help groups that provide experience, strength, and hope from other recovering addicts in an in-person setting. There is now a unique opportunity to reshape and update addiction treatment networks with a focus on removing the stigma. Defining telehealth. So as we may all have heard, telehealth, remote medicine, telemedicine, virtual care, and e-health are often used interchangeably. However, they're all really different with their own distinctions. Telemedicine is defined as medicine at a distance. Telemedicine involves the exchange of information across various modalities. Telemedicine also refers to clinical services. However, telehealth involves the use of digital information to access healthcare services, including education to manage a person's health. Telenursing specifically can be described as nurses using the nursing process by accessing the internet, computers, telephones, telemonitoring equipment, and digital assessment tools. The main goal is to improve health while mitigating obstacles to quality care. Potential to transform the healthcare industry. Also, there's increasing value in quality care and a reduction in costs. Why telehealth is important in healthcare informatics. There's increased access for seniors and those in remote areas. There's also increased access to those dealing with shame, guilt, and doubt, such as the behavioral health population. Increases remote access for providers. Telehealth delivers care to people in need. It keeps low-risk patients at home, decreases the chance of nosocomial infections, being hospitalized, developing an infection, and then having an additional diagnosis. Now you will get your treatment virtually. Telehealth also improves patient outcomes. There are financial gains for hospitals and practices as they broaden their reach. More access to specialists. It protects patients and staff during this ongoing pandemic, and it frees up beds for those that need hospital care. So this slide is a phone that I see measuring heart rate. I'm just going to say for this slide that it could be measuring a fast heart rate like tachycardia. Then there's an arrow to a pill. So I'm going to say that this pill could potentially be atenolol, propranolol, or metoprolol to manage this patient's tachycardia. We see the phone also pointing to the stethoscope, and then eventually perhaps to the ambulance. So maybe this may be a case where someone had a fast heart rate, the doctor told them to change their medication, they did, and there wasn't a good outcome. So this patient was advised to go to the hospital via ambulance, and they needed to seek additional treatment. This could be the benefit of remote monitoring, quick intervention, and achieving the goals of safe care with telehealth. Description about the research and how it relates to telehealth and my future role. So telehealth uses two types of models, asynchronous and synchronous. Asynchronous is the two-way communication in which there can be a time delay between when a message is sent, when it is received, and when a response is communicated. An example of this is email. Generally not eligible for reimbursement. However, there has been more leniency due to the pandemic. Asynchronous is advantageous to address cultural and language barriers because of the delay. Synchronous involves the capture, processing, and presentation of data at the time the data is originated. Example would be a telephone call or a live video conference. It allows for a clinical decision within the session to be made. Synchronous also improves access, convenience, and efficiency. I have a personal example. During the early phases of the pandemic that I developed an eye infection, I actually utilized the asynchronous mode of telehealth, where I had to capture a picture, email it to my provider. They diagnosed my photo, emailed me my diagnosis and my treatment, and then electronically sent the medication to the pharmacy. I even had it delivered. So I actually was assessed, diagnosed, and treated without ever leaving my home. Description about research and how it relates to telehealth and my future role. Email may be useful in presenting a concern with new onset of symptoms or with medication amendments. Email may also be useful to access translators and respond in the preferred language. Telephone calls may be conducted for one-to-one therapeutic sessions. Video conferencing would be preferred for patients at high risk for relapse. The provider would be able to visualize concerning physical manifestations of active use and make real-time decisions and next steps. Is the paramedics. I see the red emergency box, and I see a syringe with medication. So that would be the IM Narcan that's used to treat a patient that's recently overdosed on opiates. I see a mask down to the right, and I'm going to say that it's still during the COVID-19 pandemic. And many of the patients suffering from addiction don't always get the care they need because staffers are reluctant to provide services related to concern of poor hygiene or homelessness. Ethical and legal issues about telehealth. There are security vulnerabilities in hardware, software, networks, and services. Unauthorized access by staff that may not be treating a patient but just may be curious. Data sharing of data. Informed consent, patients not necessarily being fully aware of what their informed consent means. Determining the ownership of the data of the electronic record. Computer literacy, where patients and/or staff may not have substantial information to utilize the computer. The socioeconomic disparities with access to technology. I'm talking about the devices. Perhaps people have phones or tablets that are old or worn, and maybe they don't have access to internet. So that is one of the issues. Lastly, the licensing and access barriers for providers. Many providers are only able to function in the state where they're actually licensed, so that creates an issue. Justify why there's no need for change. So there is a specific admission criteria at my facility determined by the Office of Alcoholism and Substance Abuse Services, also called OASIS, and it's utilized to establish the need, level of care, as well as facilitate an appropriate patient treatment match. Current practice includes using CWA, the Clinical Institute Withdrawal Assessment, for patients that are being treated for alcohol dependency, CALS, which is the Clinical Opiate Withdrawal Scale, and there's also opioid agonist therapy, where methadone maintenance or Suboxone treatment is used. And there is alcohol dependence treatment with a camprosate, also known as Campro. Brief treatment notes must be documented for a service that lasts at least 15 minutes. Identifying the target behavior the service is intended to address and identifying the evidence-based practice that's utilized to provide this service. Intimate review of OASIS regulations perhaps twice a year. The electronic medical record should also be reviewed with the admission and discharge criteria. Training and chart navigation for counseling staff. Many have very limited knowledge of terminology. Training in supporting patients during crisis moments while using empathy. This could be evaluated through random chart reviews, comprehensive chart reviews by quality assurance and risk management staff meetings to discuss strengths and weaknesses, customize corrective action plans to improve deficiencies, and use patient satisfaction surveys. Upcoming changes in technology. Below are 10 emerging technology trends in healthcare: robotics, smart hospitals, telehealth, making healthcare providers more accessible, therapeutic apps, health tracking apps, blockchain and data security to resolve challenges with interoperability, electronic health records that reduce the number of papers. This is great for the environment. Augmented and virtual reality, artificial intelligence and machine learning intelligence. And lastly, Internet of Medical Things. This infrastructure consisting of medical devices such as sensors, like those that are used for patients measuring their glucose. So this could minimize the sensory issues that they may have secondary to repeated capillary punctures. Thank you so much, and I hope you learned a lot from my presentation. Have a good day. Here are my references.